So let's, hopefully Richard will join us in the next couple of minutes while we do introductions here in New York. And Suzanne Hashem is not available today either. Okay, so here in the New York office we have Mary Oberman.
Hi there.
And Kristen Boogie.
Hello.
Beth Friedman.
Hi.
Myself. And I'm going to let the folks from GG+A introduce themselves and their roles.
Good morning or afternoon, as the case may be. This is Brian Chapman, and I'm part of the GG+A team working actually with a colleague of mine who's actually in the proposal on the analytics piece of our work.
And I'm Eloise Stewart from GG+A, working on a number of aspects of the proposal.
And I'm Donna Wiley, also a consultant and the lead on our proposal to you. And thank you again for inviting us. We're very pleased to be here.
Great. Yes. Thank you for being here. And Jenny, did you want to say a few words?
Well, I wanted to thank everybody for joining this afternoon, and particularly thank you to the GG+A people for coming into the office, because I think this really does facilitate the presentation despite this little glitch. And I just wanted to say that this is a really important initiative for Planned Parenthood, for the national office, and for the 5 affiliates who are represented in this initial stage of the collaborative. We really feel that assessing the effectiveness of trying to raise money together and have a more united case, less confusing for the donors, and one that allows people to have various levels and layers of engagement, is one that's going to be a very important part of going forward in the 21st century. And the proposal that you all have submitted is to help us to look at trying to assess the revenue potential for some of our mid-level and higher-level major gifts programs, so that we can take a look at what exists now and what might be some models for going forward together into the future. And I wanted to say that this group of affiliates that we're working with, GG+A, is very forward-thinking. You will find them to be, both singularly and collectively, I think, a remarkable group of stewards for their donors, but also very forward-thinking. So this will be, I think, a very interesting hour that we have together. And I think as we go forward on down the road, this is a key part of forming the collaborative and making it financially worthwhile for the national office as well as for the affiliates. So thank you very much for talking us through the proposal today and helping us to figure out how we might go forward together.
Thank you, Jenny. This is Donna Wiley. Before we start, may I ask, has everyone on the call seen our proposal?
Yes.
Yes. Okay, good. That's helpful. Well, we have put together some slides just to guide our conversation. If you want to take, any of you want to take the conversation in a different direction at any point, please do that. Let's make this a conversation. We're very happy to answer any question or talk about anything that we've not thought of talking about. And do we have to 1 o'clock?
Mm-hmm. That's right.
Okay. So it's funny, I'm an art historian, and I want to say slide, please. That's how old I am. But, so first of all, I want to say that we, and I've said this to Jenny before face-to-face, we as a firm are incredibly excited to have been given the opportunity to have this conversation. John Gleer and I had a chance to come in April, I believe, and spend an hour with Cecile and Marianne. That was very exciting. And then I was back in the heat of the summer to talk with Jenny and Mary and Marianne. We put together a team of individuals, every one of whom is deeply committed to your mission. And when I say we're excited, I'm really being genuine. And
she doesn't say that everywhere.
Eloise, please. It is true that I don't say things I don't mean. And I have enjoyed, I'm not going to tell you what we've learned about you, but I have to say that I've enjoyed being reminded about the scope of your ambitions and incredible service that you provide. It's quite impressive. We also know that you are a complex federation, not of the same nature as other federated organizations, and the fact that the 6 partners have agreed to come together in this important test of the potential for fundraising is significant and should not be taken for granted. I want to say that we also were impressed that you had done the work you had, and I knew this both from the conversations and from your RFP, to identify some quite specific obstacles to major gifts fundraising, major individual gifts fundraising. Because I think that they're right on, and we hope that we're well prepared to help you think about this. So just to make sure that we've gotten them right, and again, if we've misunderstood or left something out, please let me know. We know that you have widely distributed information. You do not have an integrated base of information about each potential donor, the history of your relationship with that person, and thinking about the possible approach. We know that you are very different, the affiliates and the national, and as a result you have inconsistent fundraising approaches. Not bad, just inconsistent. We know that you don't have the same level of access to important, useful research about prospects, about markets, about donor behavior in various sorts. We know that you yourself believe that you may, as a result of all of this, be asking for gifts that are smaller than you could be hoping for, and that seems like a reasonably likely outcome from what we've heard about you. We know, and I remember talking with Mary Ann about this on our visit, that you haven't set up the framework, the architecture of a consistent communications plan where you all know this is what we say, this is what we say as individual organizations, this is what we say as the collaborative, and we build our messages from that framework or on that platform. We know that you recognize that you don't have a set of protocols that you can turn to in order to think, well, when do we make a proposal on behalf of Columbia-Willamette, or when do we make a collaborative approach, or you just haven't figured that out yet. And I have to say, neither have many of the major universities in this country, which have decades of major gifts work. So it's, again, I think it's good that you know that this is not going to be an easy thing to figure out. And you know that work with individual major prospects benefits from practice, and that you haven't put into place a program where you're talking together about how to do your best work with individual donors. So you've told us all of that, and then you've told us some very practical things that you'd like us to help with. You'd like some good projections that are based in reality, as we understand it, about how much it's going to cost to launch this new program and how much you can expect to yield over what period of time. We know that you recognize that to do this well, you probably need to have some parallel systems, infrastructure support, but you probably have to have some integrated systems, and you want us to help think about that. We know that you would like a governance structure that has the benefit of the mistakes and good results that some other collaborative efforts, some other federations have achieved, but is particularly right for this partnership. And that's, I must say, one of the most interesting aspects of this project for us, because it is always useful to think, well, we've learned X, Y, and Z from other institutions, but these are the reasons those specific approaches will not work here. We know that you want to share the revenue, and you want it to be fair and transparent, and you want to avoid bickering after you put that in place, and we understand that wastes time. You want a good set of guidelines so that you, across your organization, can have an impression of what does the potential $10,000 donor look like as compared with the $100,000 donor and the $10 million donor, and then how do we deal with those individuals differently in a way that brings each of them along to the best possible gift. And we know that you want a case, as I really have said before, that is consistent but sort of modifiable for your specific proposal. proposals. We have some more notes on this in a bit, but these were the things that we thought were really high on your list as you move forward. So before I turn to my colleagues, I just want to make sure to ask whether we got this right, whether there's anything that we missed that is really very important.
A point of clarification, just to make sure that you're aware of some other activities that we're doing right now. Today was the kickoff meeting for the launch of a new donor database system that is meant for the national office, but also for the needs of the collaborative, and that's with Blackbaud. It's Blackbaud BECRM, BBEC, basically.
The new enterprise solution.
Exactly. The new enterprise solution. So,
good to know.
Yeah.
Because you were using an
yeah,
acronym.
Yes.
Which we probably have in our proposal.
That's right. And
okay.
And the affiliates are mostly on Razor's Edge and Donor Perfect. So we'll all be converting to BBEC in time for launch in July, August of next year. So that is now officially underway.
And that's great to hear. I mean, it is, as you know, a very challenging but fruitful process to go through this. And just as a point of reference, several members of our team, myself included, and Charlotte McGee, who's listed in our proposal, is working with you on some systems-related issues, are working with clients on some of the early large-scale implementations of BBEC. As you know, it's not in a lot of big places yet, but they certainly, it is their ambition, and they are having great success in winning that business because it's a very attractive product that they're putting out there, but there's a lot of learning to be done about implementing it in an environment as complex as yours. And so for what it's worth, that is something that we have some experience with, and I think it's great that that's running in parallel to this because the two need to really be set up to coordinate.
And the other activities, the members of the collaborative are working together to identify some of these issues around governance and things like revenue sharing. So we've started to have those conversations and just putting it on the table what some agreements might look like. So we'll look to have you dovetail your work with that work so that there's some efficiencies realized.
Of course. That's great. That's great.
And Jenny or Annette or Lori, anything from your perspective, or Kristen?
I do not have anything to add.
No, thank you.
Yes, I'm good.
Okay.
Great.
Okay, so we thought we'd talk for just a little bit about the firm, particularly, obviously, in its relationship to our potential work with you. Louise.
So I'll jump in here, and let me just echo Donna's thanks for the opportunity to be here today. It is it's such an interesting project, and obviously a wonderful organization, and we look forward, we hope, to working with you on all these projects. So we're talking a little bit about what Grenzebach-Lehr is, or GG+A, which is much easier to say for those who are not familiar with the firm. So perhaps, to set the context here, we want to talk about the fact that it's a 50-year-old firm, that it's an international firm, that it's everywhere within the United States, all of which has applicability for Planned Parenthood. But maybe more important is what we do when we're in those places. We have very senior consultants. It's distinctive in that everyone who's in these positions has a very rich history of working in the field. And so you're getting very senior people, which we think is important because of the way in which we dig deep and really analyze what the clients need. It's not a firm. I'm a longtime client who joined the firm 2.5 years ago, and so I still feel like I can say things relatively objectively about what GG+A is, but it is a firm that is evidence-based, that really is not just intuitive, doesn't bring the formula from one place to another, doesn't think they're absolutes in anything that we do. Well, there are probably some absolutes, but not absolute structures, not absolute solutions. So the other thing that I think it's important to note, so it's evidence-based firm and one which is very tailored to the particular needs, and we dig deep. the other thing that probably is our best credential is the fact that we have very long-standing relationships with clients, 20, 25 years in some cases. We continue to presumably bring value to those institutions and figure out ways in which we can help them improve their programs and continue
49 at Nebraska.
No, I did not even know that. That's impressive. So just to give you a sense, I don't know if there are any questions to that. Are most of you pretty familiar with the firm? Okay.
And just to talk a little bit about some of the characteristics, to build on what Eloise was saying that we think distinguish us, there's a couple of things that we would highlight on this page. We do have a lot of experience with national advocacy and social welfare organizations, and we understand the challenges that those organizations represent, different than other sectors of the non-for-profit world. We think that because we have experience broadly across the nonprofit landscape, we're able to understand what practices make sense to be tested in different places. But we're not going to suggest that anything fits all. But we do have a lot of experience with organizations in this sector, and very much from an analytics perspective in the work that I do in collaboration with my colleagues, in taking a look at very large sets of donors and trying to figure out how do we prioritize within it. How do we make sense out of what is a vast number of people so that we can actually build programs that can generate gifts without tremendous inefficiency? So we'll talk about some examples of those in a little while, but we've done quite a bit of that. We also have extensive experience in healthcare, and Planned Parenthood is such an interesting organization, to echo my colleagues, because you are many things, but among them you are just a stupendously large healthcare provider. And understanding how healthcare organizations work and how that translates into the development of major gift programs and prospects is also important to bring to this. Building reliable donor bases from the ground up, the third point here, really addresses a number of aspects, including the operational, what are you doing from a systems standpoint to really understand your donor base, but also how are you setting up your organizations to really cultivate that donor base in an effective way. And finally, the infrastructure and database requirements. I'm excited that you guys are going to what I think is really sort of the next best-in-class system in Blackbaud Enterprise. Understanding how within that to structure it best to suit Planned Parenthood's needs, the needs of all the partners within this project, is really a tremendous opportunity to bring what we've seen in other places, what you've discussed internally, and what led you to that decision to really maximize that for you, because it's a big undertaking, cost, resources, etc. The last couple points we'd make on this before we start talking about what we're actually proposing to do is we really do spend a lot of our time building major gift programs. When you look across our client base, what distinguishes them, I believe, is a significant commitment to major gift fundraising as an engine of fundraising growth. And we've worked with organizations across the non-for-profit spectrum, obviously in universities and healthcare, but also places like the Corporation for Public Broadcasting and others, to say we know we need to elevate the fundraising opportunity that is represented by our database. How do we use analytics? How do we use program counsel? How do we use coaching and mentoring? How do we use organization structure to maximize that opportunity? We think we have a base of knowledge about environments that you're operating in and that your affiliate members are operating in. It is not the same to say that what's happening in Philadelphia is what's happening in Oregon, is what's happening in Arizona. And because we have a very broad national reach, we think we have some perspectives we can bring to how to look at this in a way that is both affiliate, partner, and nationally focused.
I'm going to interrupt and just say that we do have specific, to supplement what Brian just said. Eloise lives in Atlanta. I lived and worked in Philadelphia for 20 years. And in fact realized that I think I just remember this, the first time I was ever solicited personally was by a good friend, and I think this was about 30 years ago. I think I pledged $500 a year for 3 years when Planned Parenthood of Southeastern Pennsylvania was moving to a new building. So it sounds
yeah, it is interesting.
Does that sound possible?
Right. I mean, I did want to point out. I did want to point out this is not sort of traditional consultant sales presentation nonsense. We live currently in a number, or work in a number of the affiliates who are partners in the CFI initiative. And I'm actually, because as consultants we can live anywhere and do our work, I'm actually in Chicago where you have one of the partner organizations, and I'm considering a move to Oregon. So literally, we'll cover everybody here. I'm telling you, I will go and spend time with the Willamette Columbia. I mean, I will be there. And finally, I guess I would just point out the last bullet point. We take the issues of controversial causes and donor privacy, the privacy of our client information, extraordinarily seriously. And we have experience, whether, if you think about it, we did analytics work for the ACLU that spends a lot of time trying to make sure that people's privacy is protected, and we're doing screening and analysis on donors. We've figured out how to thread some needles here because we are extremely committed to maintaining the confidentiality of donor issues and of your issues, and also understanding how do you do fundraising in an environment where there are passionate supporters and, in fact, people who are not passionate supporters and, in fact, passionate opponents in certain cases. So I think that's something that our experience, the depth of our client experience brings to us.
And I think it's worth noting, since we're talking about major gifts, that we take that very seriously, both at the broad-based level, but also with individual principal gifts donors. And I can say from experience, having been with the firm for 12 years, it happens all the time now that I go in to interview a prospective donor and realize that we've had a conversation before about another institution. And I think we are quite practiced at helping donors to understand and helping institutions to understand that when we are working for you, we're working for you. And we don't carry information from one institution to another. I mean, it's critical given our scale that we be able to do that.
This is just a list. We won't go through this full list, but we're happy to talk about things now or in the future that just we think is some representative sampling of current and recent clients that we think in one way, shape, or form, in our estimation, have anywhere from direct to tangential things to teach us about that may come to bear on a project like this one for Planned Parenthood.
Would anyone, including those on the phone, like us to talk in any detail? We gave you some case studies in the proposal, or shall we go on to the scope of work that we proposed?
I think let's go on to the scope of work, since we only have about half an hour left.
Yeah. Terrific.
Okay.
Okay, I'm going to jump in here again. So want you to understand how it is we would approach this portion of the project. What we first want to know is, and that this goes back to our thesis that we don't pretend to understand everything about your organization, so we're going to ask for a lot of material. And what we want to do is to understand the way in which you keep your records, the way in which you analyze your performance, what people do, how they spend their time, what they see as important, and to really make sure that we understand all of that before we get into the business of then, which is the third step, of the individual on-site interviews. But the request for materials will, I think, if you haven't worked with GG+A before, will astound you in terms of the kinds of questions that we ask that sometimes are revealing to yourself about what it is you know or don't know about the organization. And I don't mean to presume that you don't understand everything, but again, having been a client, I know how sometimes that is just so educational. So a lot of a big portion will be the request for materials, and then we follow that up with individual interviews. And the proposal, as you see, was 5 days of interviews here and 2 days at each affiliate. And those individual on-site interviews build on the information that we have. Those are not in isolation to the request for material information that we would then possess. We use that in order to begin to fill out the picture of what it is that we think are the biggest challenges, the biggest strengths, and probably test some ideas during a number of those interviews. The benchmarking analysis is obviously complementary part of this, but somewhat separate. It's a process of deciding in tandem with all of you what the proper organizations are to use to benchmark. There's nothing quite like Planned Parenthood, of course, but there will be characteristics of different organizations, some of which are on that prior page, where there is great relevance. And in fact, the benchmarking group may look quite different from each other, but there are characteristics that we're pulling that we think are important. So that's the process that we would go through with you to determine exactly who should be in the benchmarking analysis and what do we think we can learn from that.
Another component of phase one is doing the analytics work. And I won't go into sort of the true data geek detail of this unless people want to, but let me basically say we're going to try to do a couple of things through the analytics work. First, we're going to take this vast number of donors and prospects who sit in disparate systems today and try to create a consolidated picture of what the opportunity really looks like. So that prospect level analysis has two components to it. The first is wealth screening that you've all seen many times and is a pretty tried and true process of matching names and addresses against databases of public information in order to create some understanding of what people's philanthropic gift capacity might look like. The second piece that some of you may have been through but others may not is a predictive modeling process where we're really trying to understand here is not what are people capable of doing, but what are people likely to do. And the likelihood models that we've built have been based on reviewing, at this point, more than 100 million records and looking at donors and saying what characteristics suggest someone is more likely to be a major gift donor in the near term than someone else. We don't write anyone off, but we do need to focus. And the focus process is about saying who appears more likely in the near term. And that's based on a variety of factors. They're giving histories with you, but also external information that we bring to bear on those prospects so that at the end of it, we're in a position to say affiliate by affiliate and across affiliates, here are the characteristics of your databases. Here's where the depth of opportunity really exists. And then we bring those building blocks together in the last piece you see here called Major Gift Portfolio Analysis. Where you have major gift-focused fundraisers, we want to look at the portfolios of prospects they're working with that information in hand to say, have we optimized the opportunity for these fundraisers to be successful? Have we created portfolios that are balanced in terms of short-term and long-term prospects, the right kind of capability of prospects, and are those portfolios suited to the development officers themselves? And where they don't exist, we can use the same information to create new ones. How do we model portfolios where they haven't existed before so that we are accelerating the development officer's speed to success by saying, we're going to give you a really tight group of 150 prospects who have been vetted this way, who have these kinds of characteristics, so it is easier to cut down that cycle from new to productive into whatever short time frame we can make it happen.
And the other thing that I think has been so valuable with the major gift portfolio analysis for a lot of clients is not just the additive, but also pointing out where people are spending their energy with prospective donors that are charming, but not the right people to make sure that we have enough money for the future. And I think it worked so well.
And we are actually working on a charming score for prospects, though we haven't quite gotten to that yet. So we're assuming charming for right now. What we're going to come back, though, is, and again, all kidding aside, what this is really just trying to do is say there's no way to take a group as large as you have in terms of prospects and prioritize them without putting some facts and analysis around it that gives us a sense of what's possible. So you heard Donna mention, and you'll hear Eloise again talk about in a few minutes, the idea that one of the things we want to do is build a revenue forecasting model, something that says what could we really realize by doing this. This information is not just from a prospect management standpoint critical, it's also critical for factoring into the business model of what is really going to mean to raise major gifts at Planned Parenthood.
It is a very exciting process that for those of us who remember when fundraising was all managed intuitively is just illuminating, I have to say. But I would also say about Brian's comment about having screened 100 million records, I think one of the advantages that we bring is the breadth of types of institutions we've grown to understand, because we know that people who support Planned Parenthood are not like alumni. They're alumni elsewhere. And we also know that they're not like patient donors at major medical centers, but maybe they're a little more like those than like alumni. So I think that we would really look forward to working with you, as we have at some of our other large-scale service delivery advocacy groups, in thinking in a number of passes about how to refine the understanding of what your prospective clients, or donors rather, look like.
And just to add on to that, so that 100 million example is really just the number we've screened, and that doesn't even count the fact that for the American Cancer Society, for example, we have their entire 56 million person database and have done analyses across the whole thing. We only screened, I don't know, 600,000-700,000 of those. But again, we've got a lot of experience working with very large numbers and trying to make them productively useful for you.
So I'm not going to read the slide that you can all see, but I'm going to make just a couple of comments. I think we all understand that there are various approaches to consulting. Some of it is counsel in that old-fashioned but still very useful way about, let's talk together about how to wrestle with this specific problem. But some of it is hugely tactical, and we are experienced and understand that you want a plan from us. You don't want only concepts and a list of best practices. You want a very specific plan that has a timetable, that has specific suggestions about which individuals might carry out which tasks, that identifies tasks for which we don't think you have individuals. You might have a staffing need, and that is highly quantitative and specific in its elements. That is the kind of thing we will deliver to you. We will deliver it to you in a way that we hope will not be the end of our work together, but the beginning of a conversation. And that, I think, I wanted to be sure to say this, that we are not the firm that comes in with the 6 linear feet of reports and does a whiz-bang delivery and then says, well, good luck, maybe you need some tables propped up that have uneven legs. We want to have a conversation with you about the plan that we design, that we draft for you, really, so that we can work together about what works and what does not work. I want to speak on behalf, quickly, of a couple of other of the tasks we propose. Our colleague Joe Sanders was also with a client today and not able to join us, but Joe is very experienced in working with large and small organizations on not just case development or appeal drafting, but on thinking through what are the needs of this organization and what plan do we need to put in place for communications? How much print work? How much digital work? What do we think it will cost? What resources do we have here already that would, what can you deliver yourself, and where do you need outside support? That is really what we propose to you. But in addition, we understand that you are interested in a model, a plan, that you can then use yourself. That you don't want a model that always demands having GG+A or some other communications outside service do everything for you. So we propose that Joe would work with you on all 6 sites to make sure that the staff who would be carrying out the communications work understand what we've all agreed to do. The third element, which you requested, is simply to build a case, to build a text, a deliverable that is probably has templates built into it that's transportable, that would allow you to move forward with that fundraising process. So the other thing that you asked for, although you were very clear in your RFP that you might or might not include ongoing work, post-plan development in this stage, we wanted to outline really what we would propose to do. First of all, we would, and I think I've already said this, just want to be working with all of you to figure out which aspects of our draft plan make sense. Obviously, if we have more work to do, we go back and do more work. But to translate our recommendations into something that you actually can use. It's actually the part of consulting I like the most, sitting down and figuring out what we've suggested, how our perceived priorities for you are the same or different from your own, and then literally, working together to draft something new. I'm going to talk a little bit later about Charlotte McGee, our colleague who does infrastructure, and what the kind of work she's done. But we presume that in that area, you will simply want an experienced colleague working with you to make it happen, who can get down to whatever, I guess maybe not the bits and bytes level, but a very, very specific level about how you use fields and attributes, whatever it is that you need help with. And we know that, and we've already talked about this really, that you will want some continuing support of the Major Gift fundraising program, and we'd like to provide that for you.
Moving on to the Major Gift Officer mentoring and coaching, realizing that we're flipping slides here. I guess you're seeing the slides, so we're good with all of that. So this is really, this is from our standpoint, very important and a continuation of what Donna's talked about in terms of we don't just deliver a tome and say, okay, make it work for you. But in fact, this would allow us to, beyond the general organizational structure, to work very specifically with the major gift officers. How is it you measure? How do you spend your time? What are the most important tenets as we go forward? Doing this, there's going to be some commonality. There's going to be some individuality. We're very familiar with this format. We've done it. I've done it a fair amount myself. Actually, spending a lot of time with major gift staff. It's a big problem within our industry. I think it may be fair to say that we have a lot of people who don't quite understand how it is that you triage, how you use that analytic information, how it is you fit into the big picture, and how it is you can be successful. So, I'm absolutely delighted that this is a part of what you're interested in having as a part of the plan.
We have, as requested, prepared a timetable. As we were meeting, my colleagues and I this morning, Brian said, it looks as though we're all going off to Tuscany in May. But in fact, we are projecting that, that's when we all get together, the 6 of us who we proposed would work on your project, together with some very talented colleagues in our Chicago office, and we're going to figure it out. So, in fact, there is often a pause where we're off meeting face-to-face by phone, sharing drafts, and getting our plan draft together for you. And we have, at least as a straw horse, proposed that would be in the spring. I'm just going to say that we take client timetables very, very seriously. And when we agree to work together, one of our first steps is always that we translate this kind of broad brush starting point to something that has week-by-week deadlines. And then we keep, obviously we say, does this work for you? But then when we agree, we meet our deadlines, because we know that that's very important. We wanted to tell you just a little bit about the people who are on the proposal. I know that we don't have much time. Tell me whether you would like us to do that, or whether we should stop for questions at this point.
I think stopping for questions is a great idea. I want to make sure that there's plenty of time for that. Jenny, Annette, Lori, what are your thoughts?
This is Annette. The timeline that I looked at, and it showed the well screening, I think, all that, all the philanthropic analysis starting in February. We won't have our database merged until July. And I was wondering whether, whether that's an efficient way of doing it for us all to submit our separate data, or whether we should wait, whether it might be or more efficient to wait until all the data is merged and then do the analysis.
It's a great question. We've built this plan around the idea that we will take separate feeds, and there's a couple reasons for that. One is that it's not significantly more difficult for the analysis piece to do it that way. It is obviously a little more challenging for each of the affiliates to submit data on their own, but we wanted to be very mindful of time. The DonorScape analyses, the major gift portfolio analyses, very much fit into the comprehensive plan of action. And if we wait until July, and forgive us for being not cynical, but maybe skeptical in the sense that we've seen a lot of deadlines for go-live dates on system conversions that don't always hit on the day. And I'm not suggesting that anything on your end or on Blackbaud's end, but I'm just saying best laid plans. What we don't want to do is wait until that's perfect in order to do things, because perfect can't be the enemy of us moving quickly on this. So in an ideal world, Annette, you're exactly right, we would have it all in one database, but we haven't seen that ideal world yet, and we planned around a less than ideal one.
Gotcha.
I would just, I am not a technical person, as you know, but I will say from experience that one of my own clients, Pittsburgh Medical and Health Sciences Foundation, serves the University of Pittsburgh, its partner hospital network, and its 20-plus member hospitals, each of which has its own database. And we have done multiple screenings for the unit and the two primary entities in a way that has been satisfactory and useful to the producers and partners. I mean, we have figured out a way to deliver the data back in a way that is appropriate to the level of access that member organizations decide is useful.
And we've worked with large national chapter and affiliate-based not-for-profit organizations in both ways. We've had some where they had a central database, they gave it to us, and then we segmented the results back out to chapters from a central database. That's the American Cancer Society model that we worked on. We've had others where it came to us from chapters and affiliates. We did the analysis, kind of normalized across the chapters, fed the chapters back their information that way, but we're also able at our end to aggregate it in a way that could give you a national kind of litmus test as to how did it look, what does it look like, how do we compare chapter databases to each other in terms of the opportunity they represent, which actually gives you 6 months head start on when you'd be able to do that if you waited until it was all consolidated.
Okay, great, thank you. And I have one more question. And I'm not sure, this is not necessarily a technical question, it's just something that occurred to me. I want to find out whether you have experience with this. So we're talking 6 different organizations that are merging their fundraising. And I'm assuming that, I know I do, and I'm assuming that my colleagues do also have existing relationships with either consultants or mentors that have helped them with their fundraising program, whether they've gone through a capital campaign or, you know, just general consulting. So how, as you're talking about moving forward with us and mentoring and with our staff and being there for an ongoing resource, have you thought about how you might incorporate those relationships into it, or is that, you know, is it a cut the ties with everything you've done before and we're it now?
Yeah, it's a really good question. I'm going to joke and say, of course, we want to be your only consultant, but we don't. I mean, we don't have expertise in direct marketing, for example. We know we don't. We are interested in learning, but that's not why you hire a consultant. I think I'm thinking of a real-life situation, a new client relationship I have myself. We are quite direct. If it appears to us that you would be paying us and another group to do essentially the same thing, because we think when you're in that kind of situation, it's a bad use of your resources, it's confusing, this isn't actually about our ego, it's really about what's useful for you. So we would prefer in each situation to at least have a conversation about what makes sense. Without knowing the specifics, I don't know that I can be more specific. You know, I don't want to be prescriptive, but it's a situation that is familiar to us, and of course. Does that answer your question, Annette?
Yes, thank you. Mm-hmm.
Kristen, you have a question.
So I'm wondering for the analytics portion of it, the DonorScape screening and the predictive modeling, how does that work with how is it implemented or dovetail with what we want to implement as native analytics, and how is that resident in our fundraising system and transparency? How do you work with your other clients, and how does it compare with Blackbaud analytics, which they are also pitching us as a service?
I would have been shocked if they hadn't been. I think the fundamental issue is to think about Blackbaud analytics is bundled with the software. Our analytics is bundled with our consulting. And I think it's really about how you use the information. We feel very strongly that data for data's sake doesn't actually raise anything at all, and we want to make sure that it's very much integrated. So, with that said, we think that what we do at a sort of comparative apples-to-apples basis with Blackbaud, obviously we like our way of doing it better, but they're both professional services that work well in lots of client environments. The key difference is that we know how to use the kind of analytics information that would come from the project that we've proposed, specifically in the design of major gift programs, which Blackbaud would tell you is not their expertise. In terms of the availability of information, at the end of the day, it's the exact same thing. So we work with our clients to design the strategy for the integration of DonorScape data into their donor management system, whatever it is, and we work with lots of Blackbaud clients to do that. Our data, as opposed to some others, not Blackbaud, but some others in the field, there's no hidden anything about it. So every piece of information we find about your prospects is available to you. We don't suggest you bring it all back into your system, but it's all available to you to use how you want to. So we believe that analytics needs to be transparent and become usable to you on an ongoing basis. So if you say, when you say nascent analytics, my ears perk up and I say, tell me what you're intending to build as an in-house capability, and we will design the right transition of our work into that model. If you say we want to be focused in A, B, and C, but not D, E, and F, we'll say, okay, here's how we support that, and here's what we can give you as kind of plug and play on D, E, and F. We are big believers in the idea that analytics is not a project. It is a way of raising money and managing your operation, and we want to make sure that that is integrated in your work, not dependent on us. So it's very much customized, and it's very much about how do we provide you with the information that you can use day to day. But if in fact Blackbaud said anything like, we're optimized to integrate with enterprise, I will tell you that it is not much different for how you get information out of DonorScape into enterprise from how you get it out of Researcher's Edge into enterprise.
And your modeling, in terms of predictive modeling, are you saying that you would apply what you have learned in the health industry and the higher ed industry to flag candidates for us in terms of predicting those gifts? Or are you saying that you would be building some kind of logic that fits a Planned Parenthood that's not necessarily a grateful patient or, 50-year-old
right.
disease
It's
donor?
It's the latter, but let's not forget that it's built off the fact that we've screened a lot of people across all segments of the not-for-profit world, including advocacy organizations, including healthcare organizations, including cause-related, everything.
Yeah.
So we would be wasting a resource, in our view, if we didn't say we've run so many analyses on so many records that our predictive models are built off regression analyses that are statistically valid. But at the same time, it's not a canned thing where we just come back and say, well, your prospects are the same as some other organization that doesn't look like you guys.
Or Teachers College.
Right. So it is, in our view, a flexible model built on a foundation that actually has evidence behind it.
And in that sense, of course, to say what's, I think, obvious to everyone, different from the wealth screening.
Right.
It's just, what did we find out about these people? What's the formula we've developed, which we let you change, actually.
Right.
You already know, I think. And, somebody who has a 2 rating will have a 2 rating, I'm sorry to say this, for Planned Parenthood and for Focus on the Family. It's just information.
It's about wealth.
Predictive modeling is quite different.
Okay.
Completely different.
Yeah.
Right.
Yeah.
Right. So again, I think I'm hearing in your question some of my friends at Blackbaud talking about canned models versus customized models. You got to press a little harder on that one. The reality is we're all using models that are customized for Planned Parenthood but built off of our experiences. Our experiences just happen to be involved in actually raising money and helping our clients raise money and looking at that data that way.
Well, and for one of my own clients, happens to be a university with an unusual profile. Among universities, we're doing major screening right now. And following our pre-screening conversations, we're pulling in 96 different fields and points of information that are specific to this institution because of its profile that are not typical of our higher education screening models. It is simply a different organization. We can do that. We have to work with you first.
Exactly. So, I mean, to be honest, the things that become most challenging in this is understanding what information we have access to across all 6 parts of Planned Parenthood that are going to be participating at this stage. So we're going to bring a lot of external information to it, but we're also dependent on an enormous amount of important information that you might have. One of the first complaints or concerns that most organizations have is, but our data isn't that good. Anywhere from that to our data is terrible. The answer is it's never perfect, and that doesn't matter. We work with what we have, and we build our models based on what is both available consistently and available sporadically.
Thank you. So, I want to make sure that Mary, if you have any questions, or Beth, if you have any questions, you have a chance to
Do you have some questions? I'm really sorry we have a meeting that we covered. Yeah. And that is the time that I was thinking about it. I mean, we just did our screening last January, 20,000.
And that was just well.
Right.
Can you speak up in the office there? I can't hear you.
Yeah, I'm sorry. The comment was that there had been a screening in January of about 20,000 donors from here,
right.
And it was 2 things. It was well screening, and it was a kind of predictive modeling we do, not the full one. It's something called a philanthropic capacity rating, which it's just a little bit different. We've got several different types of predictive models, and that one was developed. Without boring with the details, it was developed to not penalize people for not having given before. We all know when you're looking at major gifts, we actually want to give points for people for having given before. And so we have several different models that look at it a couple of different ways. So you got one of them, but this includes all of them. This is broader than what you did back in January.
Thank you so much. Thank you. Bye, Mary.
So back on,
Thank you, Beth. Nice to meet you.
Back on the phone. Any other questions before we move on?
I do not.
Okay, Jenny or Lori?
No, I'm good. I'm good too, thank you.
Okay, great. Wonderful thing about this meeting is that it's been recorded, so we'll actually have access to the conversation and the presentation for quite a while, so we can actually go back to it and listen for specific points if anything was unclear. And hopefully we'll have access to you for any additional questions as they arise as we talk after today.
Absolutely. And let me also mention, you'll have seen in the proposal and in the presentation as we flip by it that the name Dan Lohman is in the proposal doing analytics work. Dan and I are colleagues and peers. We work together all the time. Dan couldn't make it today, but knowing the emphasis on analytics, I'm filling in for Dan today. The only thing I will say just in closing is that Dan's much better at this than I am. But in all seriousness, Dan has worked here with Planned Parenthood. Dan is our analytics lead on a number of our large national nonprofits. And Dan was really instrumental in the building of the DonorScape product as it exists. So I will tell you that you could not have a better person, ego aside, you could not have a better person listed in the proposal and working on the GG+A team for you. So please feel free to contact any of us, including Dan.
Wonderful. Thank you. Well, folks on the phone, thank you so much for joining us, and thank you for coming all the way over here to meet with us and talking a little bit more about the proposal. I think it's been very, very helpful.
Good. Thank you.
It's our pleasure. Thanks to all on the phone.
Thank you.
Thank you. That was very impressive.
Enjoy Amsterdam.
Thank you very much. Brian, Eloise, and Donna especially, thank you.
Thanks.
Our pleasure. Okay. Bye-bye.
Bye.
Bye-bye.
Bye-bye.
Bye.